ऑपरेट हुए कितने दिन हो गए जी? ऑपरेशन कब हुआ है जी बुजुर्गो? 3 तारीख का मतलब है कि आज है 7 है 8 है, आज 7 है। चौथे 5वें दिन जाके वूंड से ब्लीडिंग शुरू हो गई है। व्हाट कैन बी द रीजन फॉर दिस ब्लीड? तीसरे चौथे दिन ब्लीड हो 23 तारीख को 2 वीक्स हो गए, 2 वीक्स के बाद ब्लीडिंग स्टार्ट हुई है, ठीक है। तो व्हाट कैन बी द कॉज ऑफ द ब्लीड इन दिस पेशेंट?
एंटीप्लेटलेट ड्रग्स।
नंबर 1 दैट कैन बी द इफेक्ट ऑफ द ड्रग, लाइक कोई एंटीप्लेटलेट ले ली और जैसे क्लोपिडोग्रेल है वो खा रहा है, जिसे खून पतला करने की दवाइयां वो आम अल्फाज में कहते हैं, वो ले ली, ठीक है। What else can be the reason for this bleeding from the womb?
सर अगर
इंग्लिश में बताओ।
if if the patient is in negative nitrogen balance, then the clotting factors will be reduced.
Like if some clotting disturbance has happened and the patient has got a deranged INR due to that.
Yes, sir.
What can be the reason for that? Why there is coagulopathy?
Malnutrition, there can be one.
Malnutrition. What else?
There can be some congenital disorder of
Which
hemophilia.
specific thing will be deficient in these patients? Which vitamin will be deficient?
Vitamin K.
Vitamin K dependent factors are not made. Okay. Well, what else can be the reason?
They can be this. If we have tied a vessel, that could have just slipped off the ligatures.
Slipped off after 2 weeks. Very rare.
Infection can be the cause.
Infection. If there is a bleeding because of infection, what this bleeding is called as?
Sorry, sir.
If infection causes the bleeding, what this bleeding is called as?
I don't know, sir.
This is called as secondary hemorrhage.
Secondary hemorrhage.
Secondary to the infection.
Sir.
Okay. What can be the other reason for secondary hemorrhage? एक तो infection होगी. One is the infection. What else can be?
Interventions and that we do after for debridement and dressing.
No, there is no debridement.
Foreign bodies can be there in the wound, sir.
A patient has got a fever, he has got an infected wound, and now he is bleeding from all the margins. There is a diffuse bleeding from the margins. What can be the reason for that? I am giving you the clue now.
Granular tissue is highly vascular.
इसको क्या कहते हैं? ये जो what you call this? You are thinking
Sepsis.
very. You have got a very tunnel vision.
You are asking about sepsis, sir, septicemia.
Okay.
DIC.
So because yes, there is a DIC because of the sepsis.
Yes.
So what this is called as? This is called as consumptive coagulopathy.
Consumptive coagulopathy. Yes.
If some patient has got a consumptive coagulopathy or DIC, this can be the reason for the bleed.
Yes, sir.
So this can be the secondary bleeding because of
infection and DIC.
Infection, because of DIC, because of the drugs, because of the deficiencies. So this can be the reason of the secondary bleed. So whatsoever is the reason, we have to look for that.
Yes.
And we have to treat this patient. Thank you very much.